Okay. Hi, my name is Audrey, and I'm a student intern here at Cancer Support Community. Thank you for virtually joining us for Why Weight Management for People Living with Cancer. Here at CSC, we provide support groups, healthy lifestyle classes, social opportunities, and educational programs like this one tonight to anyone impacted by cancer. A few things before we begin. Everyone, everyone will be placed on mute for the duration of the program to cut down on background noise and allow everyone a chance to hear the speaker. If you have a question, please send it to me by using the chat button on the bottom middle of your screen. Be sure to send your questions or request help by choosing my name from the drop-down box to keep the correspondence private. Type your question and hit enter. All questions will be saved until the very end of this program. You may notice that we are recording this program. We are doing so for future use and to make sure everyone has access to our programs. Please know that your name and face will not be shown in the video, and we will make all possible attempts to maintain privacy. If there are any specific concerns, please use the chat button to contact me. Some simple virtual program etiquette to ensure everyone has the best experience. If you have your camera on, please refrain from any activity that can distract others. Please be sure to turn your camera off if you will be walking around with your device. Please make sure you are identified correctly for attendance purposes. If your full name does not show up under your picture, please use the chat function to send me your correct name. Otherwise, I will note your name for attendance purposes. Thank you again for attending this program offered by CSC. Please join me in welcoming our speaker for today, Lisa Andrews. Lisa is the owner of Sound Bites Nutrition in Cincinnati, where she shares her nutrition knowledge through counseling, cooking demos, teaching, and freelance writing. She is the author of the Healing Gout Cookbook and the upcoming Complete Thyroid Cookbook. She is active at the state and local level in dietetics. Her line of Food Pun Swag, Lettuce Beat Hunger supports those suffering from food insecurity in Cincinnati. With that being said, Lisa, the floor is all yours.
Okay, thanks so much, Audrey. Thank you all for joining me this evening. I hope to cover some topics that you're interested in, probably some things that you see in the news, and hope to entertain your questions later. So just as a disclaimer, the information is meant for educational purposes only and should not take the place of medical or individualized nutrition advice. So I realize that people may get their nutrition advice from their doctor, a nurse practitioner, their chiropractor, their personal trainer, whatever it is. So again, everybody's treatment is individualized, and you want to make sure that you trust your medical practitioners. So just a few disclosures. I am the owner of Sound Bites Nutrition. I am a volunteer and a consultant for the cancer support community, which means sometimes I do some work for free and sometimes I get paid. I'm also a volunteer and consultant for La Soup, which works to end food insecurity in Cincinnati. And I'm also a consultant for the Civic Garden Center. So just a handful of topics that I'm going to discuss tonight, causes and consequences of weight gain, because it is multifactorial. And for people that maybe didn't have a weight issue when they were younger, they may develop a weight concern later in life, whether it's through menopause, medications, disability, lots of different reasons. So never blame yourself for weight gain because there are several reasons for the cause of it. I'll discuss what impacts metabolism and how you can potentially improve your metabolism, and then some tips for weight loss success. What I consider weight loss success is not just losing weight, but keeping that weight off. I also want to mention that you can be healthy at any size. So just because your number isn't down to that perfect body mass index number at your doctor's office doesn't mean that you are a failure. So weight is just a number, but I realize it is a very sensitive topic for a lot of people. So this is my little slide, hopefully to kind of lighten things up. Don't step on it, it makes you cry. So as I mentioned before, weight is a very sensitive topic. It's a very personal thing, but I want people always to remember that it is just a number. It is only one measure of health, but there's also several other parameters that are really important to leading a healthy lifestyle. So just to kind of give you a little bit of background of where we are as Americans, um, close to 75% of US adults are overweight or obese. So we're at 73% now, and it seems like we creep up every year, unfortunately. Um, Overweight and obese affects races differently. So 4 out of 5 African American women are overweight or obese. We also see some obesity in Hispanic population. So almost 50% of Hispanic adults are obese. And the percentage of childhood obesity continues to rise. So even just 3 years ago, this number was about 16%, and now we're at about 20%. And again, there's multifactorial reasons. So in kids, and adults, you know, a lot of it is reduced physical activity, reliance on convenience foods, sweetened drinks. So we've got lots of different reasons for this weight gain. Normal, overweight, obese, oh my. So let's take a look at the BMI. I like to rhyme. So the BMI is an acronym for body mass index. And the body mass index does not look at body composition. It's just a comparison of your height to weight ratio. What we find, though, is that the higher a person's body mass index, whether they're in that overweight category or obese category, is that they tend to have a higher risk for disease. We also see different diseases when somebody is underweight. So we may see malnutrition, osteoporosis. Some cancer patients might also suffer from being underweight due to their treatment, or just weight loss related to nausea, vomiting, other issues. So what's considered normal is a number between 8.5 to 24.9. That's a normal body mass index. Somebody is at increased risk for illness, particularly things that are contagious, like, you know, the flu, COVID, pneumonia, those sorts of things when they are underweight, because that impacts their immune system. An overweight BMI is between 25, pardon me, and 29.9. This is where we see certain conditions such as prediabetes, high cholesterol, hypertension, sleep apnea may start to creep in. And then at that obese level, which is considered anything above 30, and again, we have categories of obesity. The higher that number is, the higher rate typically of chronic illnesses and mortality. Now, the thing with body mass index is it does not measure body composition. So somebody could be heavier because they have a lot of muscle mass, maybe they lift weights or something, and their BMI might show 28 or 30, but they're more muscular than someone else. So this is just a measure of height to weight, but does not look at body composition, such as body fat, lean body mass, or hydration. The other thing that you can look at as far as risk factors go is how big your waist is. And we're concerned with that waist circumference because the more weight that you carry around your abdominal area, the more fat that's around all those visceral organs in your gut as well as your heart, because your heart is much lower in your body than you think. This is why heartburn often gets confused with chest pain, because your stomach and your heart are so close to each other. But for men, we want them to have a waist circumference ideally below 40, typically in that 35 to 36 range. And for women, we don't want to see a waist circumference above 35. Other things that increase risk, again, for health or poor health, are poor aerobic fitness. So if you're not doing cardiovascular exercise where you're using oxygen, that reduces your health, or decreases your what's the word I'm looking for? I don't want to say decreases your longevity, but we definitely see age prevention when people exercise more regularly. And again, it impacts specific races and ethnic groups. So future predictions for obesity, within the next 9, 10 years, over 85% of the population is expected to be overweight or obese. So if you're in that normal number or in that underweight number, you're in the minority. We don't have enough people falling in those normal numbers anymore. By 2050, diabetes will affect 1 in 3 people. And we know this is a very weight sensitive disease because even if you lose 5 to 7% of your weight, you can prevent diabetes. As people gain weight, they become more insulin resistant. So they might produce enough insulin, but their cells aren't responding to it. So with a mild weight loss, as I said, 5 to 10% of weight, that can actually help to prevent diabetes. But if we keep going at the rate we're going, diabetes is becoming more. Unfortunately, as I mentioned, we tend to see more chronic illnesses with extra weight. So extra weight, extra problems. So I mentioned diabetes is one. Arthritis is another condition, particularly osteoarthritis. We see more cancer diagnosis with obesity, particularly some of those hormone-based cancers such as prostate cancer in men or breast cancer in women, higher rates of depression, high blood pressure, high cholesterol and heart disease, kidney disease, pre-diabetes, and sleep apnea. So we know several conditions are related to excess weight. Incidentally, with the diagnosis of COVID, almost 80% of hospitalized COVID patients are either overweight or obese. And you probably heard that on the news over the summer that there was a link between the two. And part of that is probably because that obesity increases the risk for blood sugar issues, autoimmune conditions, respiratory disease, all those certain things that affect your organs over time that will impact your risk for being immunocompromised. So what exactly causes weight gain? So it's complicated. We know that if someone has at least one parent that is overweight or obese, they are more likely to become overweight or obese. If they have two parents that are overweight or obese, their risk for obesity is close to 75%. The environment. So think about places like gas stations. We no longer just have a gas station, it's attached to a Pizza Hut or a Taco Bell, or there's always donuts there, there's always sweet beverages there. So the environment itself tends to encourage us to eat more or drink more. Lack of sleep can be related to weight gain, primarily because when you don't have good sleep, it increases a hormone in your body called cortisol, which messes with your metabolism and can also make you crave carbohydrates, particularly sweets, chips, things that we don't want as much of in our diets. Again, with the pandemic, we've seen quite a bit of both stress eating as well as stress drinking. And unfortunately, that's not usually water, that tends to be more alcohol, which does impact your weight. So we can't look at alcohol as being calorie free. When people drink alcohol, it lowers their inhibition, so they tend to eat more. It also lowers their blood sugar a tiny bit, and that increases their appetite. So it definitely provides decreased activity or inactivity, sedentary lifestyle. We know that that's related to weight gain. And then certain medications, particularly for women undergoing breast cancer treatment. Tamoxifen is a common medication that can cause some weight gain. Steroids can cause weight gain. So if you've had to take dexamethasone or solumedrol or prednisone, those can also cause weight gain over time. Psychotropic medications, so things that we use to treat anxiety and depression can also, potentially cause some weight gain. So again, it's complicated. We have lots of different factors that impact the risk for weight gain. So when we're looking at weight loss, we're really looking at energy balance. So if you consume the same number of calories that you expend, ideally, you'll maintain your weight. But I will tell you over time, just about every decade, we lose about 2 to 3% of our basal metabolic rate. And the reason for that is that we lose muscle over time. So as we lose muscle, our basal metabolic rate decreases. And so we don't need as many calories as we get older. So really, in order to either maintain weight or lose weight as we get older, part of the big thing is maintaining some muscle mass, but you may need to decrease the number of calories that you consume if you're not doing that exercise to kind of back it up. Obviously, if you consume more calories than you expend, you'll likely gain weight. But although there's some people that, my teenage daughters can pretty much eat just about anything and never gain any weight, but they're young and their metabolism is much higher. Less calories in than out. Hopefully, you lose weight. And with one caveat, if you drop your calorie level down too low, it's going to feel like it's starving and you're not going to burn up as many calories. So there's that sort of sweet spot that you need to feed your body enough calories to function physiologically. Otherwise, it feels like it's starving and it's going to be much more difficult to lose weight. So metabolism is just really the process by which your body converts what you eat to drink into energy. So we have to break down our food in order to use it for energy. What I find interesting is that solid food will raise your metabolism a tiny bit because there's something called the thermic effect of food, which means your body has to physically rip it apart in order to get to the glucose or the other nutrients in there. If you drink your calories, there's a couple things that happen. For one, you take away that thermic effect of food. So your body doesn't have to do anything with it. It's already been pulverized. The other thing is that it's going to pass through your body much faster, which is not going to hold you over as long. So the two nutrient components that sort of not slow down your metabolism, but sort of slow down your digestion a little bit are protein and high fiber foods. So if you eat something high in fiber, it takes longer for your body to process that food so it sticks with you longer. And I can talk about which foods are high in fiber. So as I mentioned, there's several things that impact your metabolism. So obviously the nutrition that you eat. Um, we see this in research that if you have more of what we call a plant-forward diet or a plant-based diet, where you're eating lots of fruits and vegetables, probably more vegetables than fruit because fruit's higher in sugar, um, not as many processed foods, smaller servings of meat, less servings of high-fat foods and desserts and processed foods, you're probably not going to have as big of a weight problem as somebody that's eating more fast food or alcohol or sugar sweet drinks. From a sleep standpoint, ideally you want to get between 7 to 8 hours of sleep per night. As your sleep goes down, it impacts different hormones that can cause you to be hungrier or eat more. The other thing is if you're sleepy during the day, you feel more fatigued. And probably one of the things that people do when they're tired is that they eat or they drink more coffee, which might have some calories in it as well. We recognize that stress can impact digestion. It can also lead to overeating or undereating or stress drinking and all those sorts of things. So we want people to manage their stress in the best way they can, whether that's through journaling, seeing a therapist, talking to a friend, going for a walk, doing some yoga, whatever it is. The stress of our lives is not going to go away, and even happy things are stressful. So Audrey mentioned graduating and getting done with school, not to put her on the spot, but that's a stressful time, even though it's a happy time. Somebody getting married in your family, that's a happy thing, but it's also stressful. The other thing that impacts metabolism, obviously, is movement. So the more consistent and regular your exercise is, the better your weight will be in the long run. And that's very important. So you want to find exercise that you enjoy. If I tell you that downhill skiing is the best exercise for weight loss, that's great. But if you hate to ski and you're not near snow and you don't know how to ski and you don't want to start, then what's the point of my telling you that? I would find something that you enjoy doing and do it on a regular basis to keep up that muscle mass. So the things, again, that improve your metabolism, obviously eat nutrient dense food. So the difference between nutrient dense and calorie dense, something like kale or broccoli or spinach or an apple, Those are all considered nutrient dense, where they're very high in nutrients but low in calories. Something that's energy dense is calorie dense. A cupcake, a muffin, a bowl of ice cream, uh, bacon, those sorts of things. So those are calorie dense, but not really nutrient dense. So you might eat that, but then your body's going to want something real. You're going to feel hungry for food that contains nutrients. Try to eat mindful portions, and I'll talk a little bit more about mindfulness and portion size and later in my talk. Drink water. So we need water to digest our food, but if you're drinking water, ideally you're probably not drinking something else like juice or Gatorade or soda or something like that. Um, you can also have seltzer water. So seltzer water is also hydrating. The reason I mention hydration is that if you're dehydrated, your brain thinks that you're hungry when really you might just be thirsty. So you want to make sure that you're drinking at least 16 ounces of water per meal, which is roughly about a bottle of water. Make sure you're moving every hour. I mention the pandemic often because so many of us, including myself, have had less activity because we're not going anywhere. So, if we were previously working in an office, we're getting up, every couple hours to either go to the bathroom or make our lunch or whatever it was, where now we're kind of glued to our laptops. So for every hour that you're sitting, try to get at least 3 minutes of movement so that your blood's flowing and your brain is getting a break and your muscles are moving. Again, simplify stressors and try to get that 7 to 8 hours of sleep when you can at night. The biggest variable, as I mentioned, with weight is really exercise. Obviously, you can manipulate your diet 6 ways to midnight, but eventually you get hungry and you eat. Not saying that exercise is more important, but exercise is probably the biggest variable when it comes to your metabolism. You can't really modify your metabolism that much. You can modify it a little bit with what you eat, but muscle is more metabolic than fat. And so we want to maintain muscle mass. So I can't stress that enough, that exercise really needs to be part of the equation when it comes to particularly weight loss maintenance. The weight loss itself will come off obviously with limiting your calories, but when you want to maintain that weight loss, you have to do both calorie restriction as well as regular exercise. So now I'm going to kind of dive into the talk about what diets or which diets work for weight loss, because I will be honest, any diet that you follow will work for a while and until you either get tired of it or you can't sustain it, or it makes you sick in some way, which we don't want to happen. So one of the most popular diets that you hear about today is a low carb or a keto diet. Um, a low carb diet basically eliminates sugar, bread, cereal, most dairy, fruit, beans, I should mention, are in that as well. So beans are a really healthy food, but you can't eat them on a keto diet. A low carb or this ketogenic diet will help with initial weight loss for some people. That initial weight loss in the first 2 to 4 weeks is typically fluid, and I'll talk a little bit about that. With this type of diet, calories really aren't counted, so we don't really know, how many calories are actually suggested. But because this is a diet that's primarily animal-based, because most foods that are high in protein or high in fat tend to come from animal foods, bacon, butter, beef, chicken, eggs, all those things are allowed on the diet. We see higher rates of cancer. And the reason for that is most of the antioxidants that you get from your food are from plants. Now, obviously, you can go pretty plant heavy with this diet by eating, lots of spinach or mushrooms or low carb vegetables. But by and large, the diet itself is mostly fat. So most of the calories are coming from fat and not necessarily protein. A low fat diet tends to be higher in carbohydrate because the fat's restricted and the protein isn't necessarily too high. A low fat diet is used to lower cholesterol. Usually with a low fat, or we call it calorie restricted diet, we're not just going to say, oh, we'll just eat low fat, because the calories do count. With a lower fat diet, we see lower rates of cancer, particularly again, those hormone-based cancers such as prostate cancer and breast cancer, but also cancers of the colon, cancer of the pancreas, cancer of the liver. So a low-fat diet in the long run is definitely more healthy for you. Just to give you a little background, and again, this is not meant to be taken as, you should do the keto diet for weight loss. I just want people to understand sort of how it works. So normally, when you eat carbohydrate, your liver stores carbohydrate as glycogen, which gets stored in both your liver and your muscles. And then in between meals, your body releases glycogen as energy. It breaks down glycogen to make glucose for your energy. So glycogen is a really big molecule and it holds water. So when you eat carbohydrates, you're gonna soak up some water like a sponge. In the absence of carbohydrate, you're not going to store that glycogen. So that initial weight loss will be fluid. You're going to lose some of that water because that glycogen is no longer being stored. Over time, without any carbohydrate in your diet, your body's forced to break down fat. Now, the interesting thing is the fat breakdown becomes ketones, and your body can use ketones for energy, but it really prefers carbohydrate. So if you have a small amount, even a small amount of carbohydrate, roughly 130 grams of carbohydrate, you will break down fat, but you won't produce ketones. You'll just produce some glucose, which can be used for energy appropriately. The issue with ketones is that they are acidic, and so they put more pressure on your kidneys to sort of urinate them out or pee them out. And so they get excreted in your urine, and part of that weight loss initially is just water weight. There's also something that people experience called the keto flu. So about, very early on in the diet, people can feel sort of nauseous and sort of fatigued because your body wants sugar. Your brain wants some sugar. And when I say sugar, I don't mean a pack of sugar or Skittles or something like that. What I mean is your body wants some carbohydrate for energy. So that's why we encourage people to have fruit in their diet and grains in their diet, like whole grains or beans, because those break down to provide sugar for your body to function normally. So does it work? It does work, however, with some downsides. So it's potentially beneficial in insulin resistant dieters. So people that have elevated blood sugar or high insulin levels may respond to a lower carb diet because they're not consuming as much or any really carbohydrates, so their insulin levels aren't increasing. And as I mentioned with insulin resistance, your body may produce enough insulin, but your cells aren't responding to it. It may help to lower blood sugar. So we do see some benefit for people that have prediabetes. A Mediterranean ketogenic diet may help women that have polycystic ovary syndrome, which is a condition of insulin resistance. But again, we need to make that diet more plant-based, which can sometimes be a little bit difficult within that parameter of being low carb. The main reason that a ketogenic diet has ever been used, or what it was discovered for use, was for seizure reduction. So we often use it, or physicians will use it in children with epilepsy or patients with uncontrolled seizures. It's also been used periodically as a brain cancer treatment. So there is some benefit to it. Again, for weight loss, though, and long term, it's a very difficult diet to sustain because eventually you want a potato or eventually you want a piece of fruit. So it's hard to follow long term. Some of the reasons it may potentially work, it may lower your appetite because the foods that are provided provide more satiety. And so they have some impact on your appetite control and different hormones. Typically, you are decreasing what we call lipogenesis because those carbohydrates aren't getting stored as fat and you're releasing more fat for energy. It may decrease your resting respiratory quotient, which can lead to greater metabolic efficiency. And then it may increase the metabolic cost, or what we call just do that thermogenesis of providing more glucose because of this thermic effect or calorie burning effect of protein. And again, I'm not recommending this as a method of weight loss. I'm just trying to give you some background by it. So as I mentioned, some of the negatives, it is not sustainable long term. It can potentially raise your risk for cancer and gastrointestinal issues. And incidentally, the rate of colon cancer is much higher in younger individuals than it's ever been. And sometimes I wonder if it's related to all the low carb diet people are doing, because it does impact your bowel function. You're just not getting as much fiber as you normally would with a more of a grain-based or carbohydrate-based diet. It raises your risk for bone loss or osteoporosis. And probably the biggest thing that I see as a clinician is this vicious cycle of weight on and weight off. So I see it as sort of a diet, cheat, repent, repeat, diet, cheat, repent, repeat. And it's not good for you long term. It's not good for your body, and it's not good for your mental health. So we want to find something that is beneficial that we're going to do long term, that's going to keep the weight off and keep us happy. Maybe it doesn't get us down to that high school weight. That's okay. We have to allow ourselves some grace. Another diet that you may hear of is called the fast diet. It's also known as intermittent fasting, and there's a couple different versions of it. So one version is called a 5-2 diet, or a 5-2 fast. This was developed by a physician in the UK. And what it basically suggests is that 5 days a week, you have sort of normal calorie consumption. So maybe you're not eating like ice cream sundaes and big donuts or something, but your calorie intake is relatively normal and not restricted. 2 days a week, however, you drop your calories down very low. But you're still eating very nutrient dense food at this time. So for men, the suggestion is 600 calories per day. And for women, it's about 500 calories per day. That's pretty low. So if you're looking at what's going to be nutrient dense within that, within that calorie range, we're looking at things like big salads, lean proteins, maybe some eggs, maybe some Greek yogurt, those sorts of things that have a lot of nutrients, but not a whole lot of calories. So there have not been a lot of studies on the 5-2 diet. There was one study that looked at the 5-2 fast with just calorie controlled diet for about 6 months. And what they found was that the weight loss was really pretty similar in both groups. So the fasting diet didn't, increase weight loss any better than a calorie restricted diet. What they did find, however, is that fasting may affect a hormone in your body called insulin-like growth factor. It's also known as IGF-1. What that level does is high levels of that particular hormone accelerate the aging process in cancer. So what's interesting is that, when we reduce our calorie intake in general, we reduce metabolism. We also we reduce the products of metabolism, meaning these free radicals that are produced, that are just chemicals that float around in your blood from, because our food has to be oxidized. So when we're in that state of fasting, we're not producing as many of these damaging chemicals. So fasting itself helps to reduce that IGF-1 hormone. In the case of this type of diet, we just need more studies. We just don't have enough to say, yes, this is good, or that, yes, this is not good. Another type of fasting is known as intermittent fasting, another type of intermittent fasting. But this involves manipulating the timing of your meals more, not so much your calorie intake. So what's suggested is about 12 or more hours of fasting. Some people do fasting for 16 hours. And then obviously we've been fasting for years for religious reasons, political reasons, hunger strikes, all sorts of reasons. But most people have their calorie consumption within about an 8-hour window. If you're doing like a 16-hour fast. Now, obviously, if you're doing a 12-hour fast, you're going to have a 12-hour window to eat. So your meals and calories are eaten typically earlier in the day, and you are fasting typically at breakfast and after dinner. So with most of this type of fasting, you're skipping breakfast, and then you're not having any after dinner snacks. And when you think about it, the whole snacking industry has kind of blown up. I mean, we're encouraged to snack at night. You know, we're watching TV and there's tons of food commercials on, telling us that, you know, the restaurants are open until midnight. Oh, nobody needs to be eating at midnight unless you're working, you're working as a nurse in a night shift or something. I mean, we shouldn't be eating at midnight. Um, so one of the reasons that intermittent fasting works is that these insulin levels drop because anytime you eat, your blood sugar goes up, and so insulin responds to that. And your body will end up using some fat in storage for calories. The thing about insulin, it's a hormone that our pancreas makes, and we need it in order to bring blood sugar into the cells. The problem with too much insulin is that it makes your body store fat. So you don't want what we call hyperinsulinemia, which is a case where people are insulin resistant. Their body's going to keep producing insulin because the cells don't recognize it. So we don't want elevated insulin levels. So when somebody is in either a state of fasting or they're consuming less sugary foods. So again, those refined carbohydrates, cake, pie, cookies, candy, those are going to raise our insulin levels much faster. So the basics of intermittent fasting during an eating period, again, that insulin level is going to go up. You're going to store more sugar in the liver and produce more fat in the liver, especially if you don't burn up those calories. Now, if you burn up the calories, that's great. But if you don't, then they get stored as fat. During a fasting period, we're going to have lower levels of insulin, and your body is going to be forced to use sugar from glycogen as well as fat for calories. So does this diet work? Does fasting work? So there was a meta-analysis of about 27 studies compared. All found that their subjects lost between 0.8 and 13% of their baseline weight. And 5 studies included subjects that had diabetes. Their blood sugar was better, which was good. But in 12 of those 27 studies, results were equivocal, meaning there wasn't really that much difference in the weight loss. The studies themselves were small and of short duration, so they didn't have many subjects. Some of the studies only had between 30 and 50 subjects. And when we're looking at research studies, the bigger the studies are and the longer they're done, the better the research. So even if you look at things like the dietary guidelines, we update them every 5 years based on research. They don't change very much because the research tends to be fairly consistent, and we're looking for more studies to support sort of what we already know. In studies comparing both either continuous calorie restriction, meaning just being on a lower calorie diet, versus intermittent fasting, again, that fasting didn't produce more weight loss, and the results were equivocal. So what this means, or the take-home message, is really any diet that you follow will work. It's just a matter of which one is the best for you and what is easiest for you. I will tell you, I've had some clients that have done intermittent fasting, and when they stick with it, it's that consistency that matters. It does work for them, and over time, they don't really miss eating at night. So what I typically suggest to people if they're going to do this type of diet is brush your teeth right after you eat dinner. And that way you're not tempted to go back for snacks. So to me, it's like a signal that the kitchen is closed. So in comparing diet versus exercise for weight loss, I mentioned that exercise is obviously very important, but you can't outrun a bad diet. So what's interesting is there was a study done a few years ago on about 1,200 mixed population. So it was US, Canadians, French, Chinese, and South Korean individuals. But the people that had the mindset that their diet was more important to weight loss typically had lower BMIs. So those people that thought that eating less was more important or monitoring their diet more tended to have a lower body mass index. The thing with exercise is people sometimes overestimate how many calories they've actually burned or how much exercise that they do. And so they might overcompensate by eating more. So they might think, well, I went to the gym for an hour, and so now I deserve this food. So what potentially can control your behaviors is your weight control beliefs. So People that felt like diet mattered more paid closer attention to how much they actually ate. And that's kind of true. I mean, if people think that it doesn't matter, they're probably not going to do a whole lot about it. But if they think that it makes a difference, then they probably will track their calories a little bit better. The thing again with exercise is if I have somebody that says, I'm trying to lose weight, I don't understand why I'm not losing. I exercise every day for 30 minutes. I hate to tell them it's not enough. So maybe break up that exercise and do 15 minutes in the morning, 15 minutes in the afternoon, and 15 minutes later. Because most of the research suggests you need at least 45 to 60 minutes most days of the week in order to lose weight. That 30 minutes a day is great for just overall health and lowering your blood pressure and maybe getting your blood sugar down a little bit. But for weight loss, we really need more. And again, that consistency is key. If you're just starting exercise, obviously I don't want you to jump into doing 45 to 60 minutes of exercise. And you will lose weight if you're not doing anything at all and you start to exercise. But once your body gets used to exercise, it becomes very efficient at using calories. And so it doesn't burn up as much. So, that initial exercise for somebody who hasn't been exercising for for a long time is going to be more difficult and they're going to expend more calories. Once your body gets in shape, you either have to change up the intensity of the exercise or change up the time of the exercise, or you have to increase the frequency or how much of the exercise that you do. So if you're doing the same exercise over and over and over, you're not seeing any results, it's because your body's gotten in shape and it's just very efficient at using calories. So again, what really works? Well, what works for you? So any diet that you follow will probably help you lose some weight. Again, you don't want your calories to be too low, but you do want to make sure that you're getting enough variety and enough nutrition in your diet so that it's sustainable. The thing to ask yourself is, are you going to relapse and gain the weight back once you're off your diet? So um, I would say the most success that I've seen with people is people that have changed things and then kept it. So maybe they gave up soda and they didn't go back to soda. They gave up their evening snack and they didn't go back to it. That helped them keep the weight off. They only drank on the weekends. That helped them keep their weight off. They got a personal trainer. That helps them. So the consistency is really important rather than going through this diet cycle. In the end, you have to eat less and move more. I hate to tell you that, but that's typically what works for most people long term. Now, there is something out there, and some of you have probably heard of this before, called the National Weight Control Registry, and it's actually a research study between two universities. I want to say the University of Pittsburgh and Colorado. And what it looks at is adults age 18 and up that have lost weight, at least 30 pounds, and have kept it off for at least a year. And they're looking at their habits. Now, these are self-reported behaviors that these people offer to these research studies. And what they found is that those who self-monitor, meaning they record their intake, they limit certain foods or food quantities, and they check their weight at least once a week. Those behaviors help for them to keep the weight off that they've lost. As far as the types of food that they eat, typically it is lower in calories. So fruits, vegetables, whole grains, and the food is low fat because fat, is 9 calories per gram, whereas carbohydrate and protein are 4 calories per gram. So the more fat that you have in your diet, typically the higher calorie your diet's going to be. Total energy intake. Now, to me, this looks pretty low, but most of the registry, I believe about 85% of the participants are female. And so it makes sense that the calorie level is a little on the low side. So 1,300 to 1,400 per day as a maintenance, which again is low. It really depends on what that person's weight is. So if it's somebody that weighs maybe between 120 and 150 or something like that, that calorie level might be appropriate. The calories coming from fat are roughly 20 to 25%, which is a little bit lower than what the dietary guidelines suggested, about 30%. Most of them eat breakfast, which again throws off that fasting because In intermittent fasting, we don't eat breakfast, but with weight maintenance and also the prevention of heart disease, you do want to eat breakfast. There's actually studies that show that men that don't eat breakfast have a higher risk for heart disease. Most of the participants also do some kind of regular exercise, burning between 2,500 and 3,000 calories per week. And again, that may be 40 to 50 minutes of exercise at least 5 days a week. So find something that you enjoy doing. There's also been some studies on which foods help to curb your appetite, and that's important because if you're hungry, you're going to eat. So the foods that don't curb your appetite are, you know, juice, Skittles, cake, bagels, things like that. They're more refined carbohydrates, don't really curb your appetite. But foods high in fiber and foods high in certain proteins help to curb your appetite. So what we found are things like almonds, avocado, eggs, Greek yogurt, because it's much thicker, it takes longer to eat. Oatmeal, particularly rolled oats or steel cut oats, beans, lentils, legumes, they take longer to digest. They don't have as much of an impact on your blood sugar as other carbs. Rye bread, I don't know why that helps, but it does. And then salmon, which is, you know, a fattier fish, and so it probably helps to keep you feeling fuller longer. Lots of decent research on, again, higher protein foods. From a metabolism standpoint, protein foods bump your metabolism up a little bit. So those also help to regulate both your blood sugar and your satiety, which is just your feeling of fullness in between meals. Another big movement now that you probably hear about is called mindful eating. And what this really takes into account is not multitasking. So if we were in person, you know, I'd probably ask how many people, you know, eat while they're doing work, or they eat while they're talking on the phone, or they eat while they're watching TV. So mindful eating forces you to pay attention to what you're eating at that time. So we're looking at not only what you're eating, but how much you're eating, the preparation methods, thinking about where the food came from, just kind of slowing down and respecting the food and respecting your body a little bit more. So, you know, are you choosing popcorn or are you choosing chips? Are you choosing a whole apple, or are you using maybe fruit cocktail or something? Are you having a calorie controlled meal, or are you having like a hungry man meal where the calories are going to be much bigger? So we're thinking about like where the food came from, how it's prepared, the serving sizes, all those sorts of things. It also forces you to ask yourself if you're hungry. And one of the most important things that I ask my own clients is, what's eating you that's making you eat? And you have to think about that. If you're somebody that is constantly snacking, or you're a stress eater, you have to deal with the stress. So I'll have somebody, they'll say, what else can I eat instead of? And I'll say, are you hungry? Because that's the important thing. So mindful eating really takes into account listening to your body and fueling it with appropriate foods, and not eating when you're not hungry. So I always say, what's on your plate? You ate too much. I'm just kidding. Plate size does make a difference. So studies show that using a smaller plate helps with weight management. And part of that is just from a psychological standpoint. We're always told to finish everything that's on our plate. And if we have a really big plate, we're more likely to overfill it. Another thing that helps is chewing your food over and over and over. So chewing your food at least 30 times makes you slow down, and you'll end up eating less. So you want to take at least 20 minutes to eat your food. This is an example of a diabetes meal plate, but I think it's also appropriate for anybody that's looking to lose weight. It gives you an idea of which foods raise your blood sugar, which foods don't affect your blood sugar that much. And again, when you're trying to lose weight, a lot of it has to do with insulin. So one suggestion I have for people is make half of your plate low sugar or low carb vegetables. So big servings of salads, you know, broccoli, spinach, Brussels sprouts, asparagus, any kind of green leafy vegetables. A quarter of it is some type of meat or other protein. So a quarter of it is beans or fish or pork or whatever it is. and then a quarter of it as either some bread or some starch, including things like potatoes or corn or lima beans, which is like a starchy vegetable. There's been some studies that show if you eat the starch in your diet last or in your meal last, that doesn't raise your blood sugar as quickly as if you'd eaten it at the beginning of your meal. So one thing I suggest to people is, do what your mother said. Eat your vegetables. So eat your vegetables first and then your protein and then have your starch last, and that might impact your blood sugar. Keep moving. So I can't stress this enough. You know, pay attention to how much time you're watching TV. So if you're watching TV, maybe you could have some little weights with you. I'm moving right now, that you could use in order to get some more movement in. Do a little chore challenge, like challenge yourself to do some type of chore within that hour. So maybe it's like, okay, I'm sitting here doing my work and I'm going to go and I'm going to clean 2 sinks in my house or whatever it is. Simplify strength building. So as I mentioned, many of us are home now, so find something that you could do to help build strength at home. And that could be doing things like what we used to call wall sits, where you just put your back up against the wall and you pretend that you're sitting on a chair. That actually strengthens your muscles, and that'll help with some muscle building. Using those stretchy bands helps. Any kind of small weights. When you're at work, have a meeting, a moving meeting. So maybe you take a walk with somebody rather than sitting with them or talking on the phone or just chatting with them online. Again, this might not happen during COVID, but another thing is just walk versus email. So once we're back in our offices, we can go walk to somebody and talk to them face to face instead of chatting with them online or via, virtual once we're back to normal. If you're on the phone, pace around while you're talking, because when you're standing, you're burning more calories than when you're sitting. So take little opportunities to move throughout the day. They do make a difference. If you're going to set any sort of goals, make sure that they are what we call SMART goals. So make sure they're specific, which means I'm going to drink 2 cups of water, at each meal, within the first 15 minutes of eating. Now, if I have somebody that says, I want to lose weight, well, that's a goal, but that isn't, we have to chunk it down. That's not a specific goal. So, what I want to hear is, I'm only going to drink 2 glasses of wine only on the weekend. Okay, that's very specific. Or I'm going to eat 3 servings of vegetables 4 days a week. That's very specific. How are you going to measure it? So again, that's self-monitoring. People that do self-monitoring lose twice as much weight than people that don't. And I always say, if you bite it, write it. So it doesn't have to be an app. It doesn't have to be anything fancy. It might just be a little diet journal that you can mark down, what you've eaten the time of day, how hungry you are, whatever it is. So making some sort of commitment to tracking will help with weight loss. If it's an exercise goal, make sure that you're making it achievable, make sure it's realistic, and then say how much time you're going to say. So if you say, I'm going to go out and walk every day, well, what time of day are you going to walk? How far are you going to walk? How much time are you going to spend walking? So if you just say that willy-nilly, we need something more specific. If it's more specific, you're more likely to do it. These are just a handful of healthy numbers. So I mentioned earlier, try to move for at least 3 minutes for every 60 minutes that you're sitting. Have 5 meals a day, so you could break them up and have 5 small meals or 3 normal sized meals and 2 snacks. Get at least 7 hours of sleep, have about 8 cups of water, take at least 20 minutes to make sure that you're feeling full, and try to do at least 30 minutes of some type of daily activity every day. And again, that's more for general health, and for weight loss, you're going to want to bump that up a little bit. As far as maintaining a healthy weight loss or maintaining a healthy weight, again, track things when you can. So track your food. If you haven't started, if nothing else, it's a good way to look at what you're not eating in addition to what you're eating. So I have my clients give me a food diary just so I can see the quality of their diet. I want to make sure there's food in their food and they're not just eating, little snippets of junk food that maybe add up for calories but don't have a lot of nutrition. Track your activities, maybe put things on a calendar as a reminder, set your phone as a reminder to get up, whatever it is you need to do. Make sure you're sleeping, make sure you're doing those SMART goals that are measurable. Involve some family and friends because this makes you more accountable. So if you tell somebody, I'm really trying to watch my weight, or, my blood sugar is too high, don't bring me any cookies, don't buy any sugar, whatever it is, because inevitably, people will use, excuses. Well, so and so brought this back, or I had my grandkids today and I had to have ice cream. You don't have to have any of that stuff. You can always take them out for ice cream if you really want a cone. So make your environment friendly to the goals that you have. Put your shoes in your car. So if you have an extra half hour somewhere, you put your shoes on and go for a walk if you need to. Get outside. Now that the COVID restrictions are sort of decreasing a little bit, it feels a little safer to go outside. We may not need masks. Obviously, be safe, but try to find some kind of exercise that you could do, ideally all year round. These are a handful of different apps that you can use that help. I will tell you, out of all of those, my favorite for looking at calories is probably Chronometer, because my Fitness Pal, I don't feel that it is as robust of a method to use, because the foods haven't really been broken down and evaluated. So I know a lot of people use it. I feel like it gives people an unrealistic calorie level. So my personal preference is Chronometer for measuring, again, like macros and those sorts of things. Noom is another one that's popular now that helps people with behavioral things. And again, any kind of behavior that you're trying to change, you want to think about why you're changing it, like what's in it for you. So for some people that might be reducing their recurrence of breast cancer. It might be lowering their blood sugar. It might be reducing their risk for heart disease, whatever it is. It needs to be something that's important to you. So keep that in mind. These are some other nice resources for information. So choosemyplate.gov, you can actually put in your height, your weight, your activity level, your age, and your sex, and it will give you a sample calorie level that's fairly realistic. It also has serving sizes. It also has very basic nutrition information that's pretty good. WebMD is a decent source for different articles. Just need to be a little bit careful because, they've gotten a little salesy over the years. Eatright.org is the Academy of Nutrition and Dietetics. They have a lot of white papers, which are research papers that clinicians write on things like weight management, pregnancy, all kinds of different topics. Spark People is local, and they often have things like recipes and ways to track and competitions and those sorts of things. And then the other two are, again, MyFitnessPal for tracking, or I believe Weight is the Weight Information Network from the National Institutes of Health. And then this is just a little quote: your body is the baggage you must carry through life. The more excess the baggage, the shorter the life. So always remember that. And if you're interested in reading one of my recipes or my rants, or you want a Food Pun t-shirt, this is my website and my social media handles. And so I'm going to go ahead and stop the presentation for now and open it up to questions. And I thank you very much for your time.